So this is the medial pterygoid. The medial pterygoid has two heads. The deep head arises from the medial surface of the lateral pterygoid plate and the pyramidal process of the palatine bone. The superficial head arises from the tuberosity of the maxilla, and the insertion attaches to the inferior, posterior, and medial surfaces of the ramus and angle of the mandible. The lateral pterygoid also has two heads. The superior head originates from the greater wing of the sphenoid bone, and the inferior head originates from the outer surface of the lateral pterygoid plate. The insertion of the superior head inserts on the temporomandibular joint, and the insertion of this inferior head inserts on the condyle process of the mandible. This is the masseter. The origin arises from the inferior border and medial surface of the zygomatic arch, and the insertion attaches to the lateral surface of the mandible and lateral surface of the coronoid process. This is the serratus anterior. It originates at the superlateral surfaces of the upper 8th and 9th ribs. Its insertion attaches to the medial border of the scapula. This is the subclavius muscle, a short, thick tendon at the junction of the first rib and its cartilage, in front of the costoclavicular ligament. Insertion of the fleshy fibers obliquely superolaterally inserts into the groove on the undersurface of the clavicle. This is the pectoralis minor. The origin is at the 3rd to the 5th ribs near the cartilages, and the insertion is at the medial border and superior surface of the coracoid process of the scapula. This is the sternocleidomastoid. The sternocleidomastoid has two heads. The sternal head arises from the anterior surface of the manubrium of the sternum. The clavicular head arises from the medial surfaces of the medial third of the clavicle. The insertion attaches to the lateral surface of the mastoid process of the temporal bone, the lateral half of the superior nuchal line. The action of the sternocleidomastoid is the flexion and the extension of the neck. The levator scapulae originates from the transverse processes of C1 to C4 vertebrae. It inserts at the superior portion of the medial border of the scapula. So this is the rhomboids. The rhomboids originate from C7 to T1 to T4, and it inserts at the medial border of the scapula. This is the trapezius. It originates from the medial line of the superior nuchal line, external occipital protuberance, nuchal ligament, and spinous processes of C7 to T12. The insertion is at the lateral third of the clavicle, the acromion, and the spine of the scapula. So the muscles involved in the elevation of the scapula is the upper trapezius, rhomboids, and levator scapulae. And the muscles involved for the scapular depression is the lower serratus anterior and the lower trapezius. The muscles involved for the scapular abduction is for serratus abduction is the serratus anterior. The muscles involved for the scapular adduction is the trapezius and rhomboids. The muscles involved for the scapular upward rotation is the upper and lower trapezius and the serratus anterior. The muscles involved for the scapular downward rotation is the levator scapulae and the rhomboids. This is the subscapularis. It originates in the subscapular fossa of the scapula, and it inserts at the lesser tubercle of the humerus. The action for this is the medial rotation of the arm. This is the supraspinatus. It originates at the supraspinous fossa of the scapula. It inserts at the superior facet of the greater tubercle of the humerus. Its action is to help in the abduction of the deltoid, and it cooperates with other rotator cuff muscles. This is the infraspinatus. It originates at the infraspinous fossa of the scapula, and it inserts at the middle facet of the greater tubercle of the humerus. This is the teres minor. It originates the lateral border of the scapula. Its insertion is at the inferior facet of the greater tubercle of the humerus. This is your pectoralis major. The clavicular head originates at the anterior surface of the medial half of the clavicle, and the origin sternocostal head originates at the anterior surface of the sternum and the superior 6 costal cartilages and the aponeurosis of the external oblique muscles. The insertion of the pectoralis major is at the lateral lip of the intertubercular groove of the humerus. The action for the pectoralis major is they adduct and medially rotate the humerus. This is the latissimus dorsi. The origin of this is the spinous processes of the inferior thoracic vertebrae, the thoracolumbar fascia, iliac crest, and the inferior 3 or 4 ribs. The insertion is the floor of the intertubercular groove of the humerus. This is the deltoid muscle. The deltoid muscle originates at the lateral third of the clavicle, acromion, and the spine of the scapula. The insertion of the deltoid muscle is at the deltoid tuberosity of the humerus. This is the brachialis muscle. It originates at the distal half of the anterior surface of the humerus, and the insertion is at the coracoid process of the tuberosity of the ulna, and the action of the brachialis is the flexion of the forearm. This is your brachioradialis muscle. The origin is at the lateral supracondylar ridge of the humerus, and the insertion is at the lateral surface of the distal end of the radius. This is the biceps brachii. The biceps brachii also has 2 heads. The origin of short head is the tip of the coracoid process of the ulna, and the origin of the long head is the supraglenoid tubercle of the scapula. The insertion is the tuberosity of the radius and fascia of the forearm via the occipital aponeurosis. The action of the biceps brachii is is it supinates the forearm, and when in supine, flexes the forearm. This is the triceps brachii. The triceps brachii has three heads. The lateral head originates at the infraglenoid tubercle of the scapula, and then the lateral head originates at the superior surface of the humerus and is superior to the radial groove. The medial head is posterior to the surface of the humerus and is inferior to the radial groove. The insertion of the three heads is the olecranon process of the ulna and the fascia of the forearm. The triceps brachii is responsible for the extension of the forearm. This is the anconeus muscle. It originates at the lateral epicondyle of the humerus, and it inserts at the lateral surface of the olecranon and the superior part of the posterior surface of the ulna. This is the pronator teres. The origin is at the medial epicondyle of the humerus, the coracoid process of the ulna. The insertion is at the medial and lateral surfaces of the radius. The action of the pronator teres is that it pronates and flexes the pronator quadratus. The origin is at the distal quarter of the interior surface of the ulna, and its insertion is at the distal quarter of the anterior surface of the radius. And the action is it pronates the forearm, and its deep fibers bind the radius and the ulna together. This is the supinator muscle. The origin is at the lateral epicondyle of the humerus, and the radial collateral and annular ligaments and the supinator fossa of the ulna. The insertion of the supinator is at the lateral, posterior, and anterior surfaces of the proximal third of the radius. The action is that it supinates the arm. This is the semispinalis capitis. It arises from a series of tendons from the transverse processes of the first 6 or 7 thoracic vertebrae and the 7th cervical vertebrae. It inserts between the superior and inferior nuchal lines of the occipital bone. This is the splenius capitis and cervicis. These muscles blend together and arise from the ligamentum nuchae, spinous processes of C7 to the T6 vertebrae. The insertion of the capitis fibers inserts into the mastoid process of the temporal bone and the lateral third of the superior nuchal line, the occipital bone. The cervicis fibers ascends to attach to the tubercles of the transverse processes of C1 to the C3 vertebrae. Serratus posterior superior. Its origin attaches to the ligamentum nuchae and the spinous processes of C7 to the T3 vertebrae. Insertion is 4 fleshy digitations. It attaches to the second and fifth ribs. This is the serratus inferior posterior. It attaches to the spinous processes of T11 to the T12 vertebrae. It inserts at the inferior borders of the last four ribs. The levator scapulae originates from the transverse processes of C1 to C4 vertebrae. It inserts at the superior portion of the medial border of the scapula. The rhomboid minor arises from the nuchal ligament and the spinous processes of the C7 and the T1 vertebrae. It inserts to the medial border of the scapula superior to the spine, and this is the rhomboid major, which originates at the T2 to the T5 vertebrae. It inserts to the medial border inferior to the spine. This is the latissimus dorsi. The origin of this is the spinous processes of the inferior thoracic vertebrae, the thoracolumbar fascia, iliac crest, and the inferior 3 or 4 ribs. The insertion is the floor of the intertubercular groove of the humerus. This is the trapezius. It originates from the medial line of the superior nuchal line, external occipital protuberance, nuchal ligament, and spinous processes of C7 to T12. The insertion is at the lateral third of the clavicle, the acromion, and the spine of the scapula. This is the scalene anterior. Its origin is the anterior tubercles of the transverse processes of C3 to C6. It attaches to the scalene tubercle on the inner border of the first rib. This is the middle scalene. Its origin is the posterior tubercles of the transverse processes of the C2 to the C7 vertebrae. It attaches to the scalene tubercle of the first rib. This is the posterior scalene. Its origin is the posterior tubercles of the transverse processes of C5 to the C7 vertebrae. It attaches to the second rib. This is the sternocleidomastoid. The sternocleidomastoid has two heads. The sternal head arises from the anterior surface of the manubrium of the sternum. The clavicle head arises from the superior surface of the medial third of the clavicle. The insertion of the sternocleidomastoid attaches to the lateral surface of the mastoid process and the lateral half of the nuchal line. The action of the sternocleidomastoid is the extension and flexion of the neck. And then extend your neck. This is the quadratus lumborum. It attaches to the medial half of the posterior iliac crest and the iliolumbar ligament. The insertion is on the transverse processes of the L1 and L4 vertebrae and the medial half of the 12th rib. This is your rectus abdominis. The origin is at the pubic crest and at the pubic symphysis. The insertion is at the xiphoid processes and costal cartilages of ribs 5 to 7. The action is that it flexes the trunk and posteriorly tilts the pelvis and laterally flexes the trunk. It is also an accessory muscle during the expiration of breath. So these are the external abdominal oblique muscles. The origin is at the lower surfaces of the ribs 5 to 12, and the insertion is at the anterior iliac spine, pubic bone, and the abdominal aponeurosis. The action is that it flexes and rotates the vertebral column, and it also laterally flexes the vertebral column. These are your internal obliques. The origin is at the inguinal ligament, iliac crest, and the lumbodorsal fascia. The insertion is at the lower 3 ribs, the 10th to the 12th ribs, and the abdominal aponeurosis of the linea alba. The action is that it flexes the vertebral column and rotates the vertebral column, and also laterally flexes the vertebral column. This is your transversus abdominis. The origin is at the anterior iliac spine, lateral half of the lingual ligament, and the thoracolumbar fascia, and the costal cartilages of ribs 6 to 12. The insertion is at the abdominal aponeurosis of the linea alba, and the Seifert process and pubic symphysis. The action is the compression of the abdomen. This is the gluteus maximus. It originates to the posterior of the sacrum and coccyx, as well as the posterior lateral iliac fossa. The insertion of the deep layers is at the superior linea aspera of the femur, and the superficial layer inserts at the fascia lata. The action of the deep layer is when the hip bone is fixed and the gluteus maximus pulls the femur backward into extension and external rotation. Palabas. And slight adduction. The action of the superficial layer acts on the femur by extending, externally rotating, and abducting the femur. This is the gluteal medius. The origin is at the broad origin of the external iliac fossa. Insertion is at the lateral aspect of the greater trochanter of the femur. So the action for the gluteus medius is the flexion and extension of the hip. This is the gluteal minimus. It originates at the external iliac fossa, and its insertion is at the anterior aspect of the greater trochanter of the femur. The gluteus minimus assists in the flexion and the medial rotation of the thigh. This is the piriformis muscle. It originates at the anterior lateral surface of the sacrum, and its insertion is at the greater trochanter of the femur along its upper medial surface. This is the superior gemellus. Its origin is the outer surface of the spine of the ischium, and its insertion blends with the upper part of the obturator internus. This is the obturator internus. It originates on the internal surface of the obturator membrane, and the posterior bony margins of the obturator foramen. Its insertion is on the medial surface of the greater trochanter of the femur. This blue tape is the inferior gemellus. It originates at the posterior portions of the ischiotuberosity, and it inserts to the medial surface of the greater trochanter of the femur and connected with the obturator internus. So, this green tape is the obturator externus. It originates at the membrane of the obturator foramen, the adjacent bone. It passes under the neck of the femur, and it attaches to the posterior aspect of the greater trochanter of the femur. This is the quadratus femoris. It originates to the lateral border of the ischial tuberosity. It inserts to the quadrate tubercle near the base of the greater trochanter of the intertrochanteric crest.